Hi everyone, Dr. Nemechek here. I want to review the growing importance of glutamine as an additional factor in the Nemechek protocol. When the protocol was developed, 20 years ago is when we started working on this. The basic components of balancing intestinal bacteria, fish oil, the addition of VNS was basically all that was needed to substantially reduce inflammation to allow the autonomic nervous system and other components to improve. And then we've learned now that by reducing this inflammation, also other physiological aspects can improve, like hypertension and different problems, arthritic problems, all sorts of stuff that adults have can improve. And then since COVID, the recovery rates have been less with the core, less intense, less complete with the original protocol, and things were a bit more confusing. And we've here now the last 18 months in some of the research showing that there's a different kind of leaky gut developing after COVID. We're learning that at least a third of the cases of COVID are asymptomatic, and it looks like that this can cause you have no symptoms, you got active virus, you're infectious to other people, you have a lot of inflammation in the body, you can develop this other form of leaky gut, and it's going to increase your inflammation and make your recovery slower or just non-existent. And that the supplement with the essential amino acid L-Glutamine is required to help fix these other form of leaky gut, what's called apoptotic permeability. And I've got other videos that go into it more detail with some pictures and things. The more I put this into consideration, the more I try glutamine and the better the recovery rates are. And so I wouldn't say it's officially the starting part of the protocol, but if people are starting the protocol and within a month or two the kind of very lackluster kind of response, I am adding glutamine now twice daily. The adult dose is 15 grams twice a day, which is a level tablespoon, and the childhood dose I use is the weight in kilograms times 0.3, and that'll give you the total grams per day of glutamine required. And the glutamine needs to be given at a minimum in 2 doses. And the more I do that, the more problems we solve, the better the recovery we're seeing. And so I just want to share that with everybody as my evolution is occurring. So if you're doing the protocol and you're kind of better and not better, you got to add glutamine and see, even if you don't think you've ever had COVID, because again, a third of the patients aren't having any symptoms at all. So it's this kind of shadowy problem that can appear and nobody even knows it happened. The brand of glutamine I prefer is from Now Foods division. It's called Now Sports. Powdered glutamine. It's available in a lot of places, Amazon, etc. So anyhow, little update on the glutamine, and otherwise everybody have a good day.